Hello and namaste everyone. Today we are going to continue our talk on Norma Basalis, that is the inferior view of the skull. This is part 2. As mentioned previously, the inferior view of skull or the Norma Basalis is divided into three parts. We are talking about the middle part of the Norma Basalis. The mandibular fossa that is present in the squamous part of temporal bone can be appreciated here. It has an anterior articular part in squamous part of the temporal bone and posterior non-articular part in the tympanic part of the temporal bone. These two parts are separated by a squamo-tympanic fissure. This fissure lies parallel and anterior to external acoustic meatus and is further subdivided into petrosquamous and petrotympanic fissure. Petrosquamous fissure is an oblique fissure present between medial petrous part and lateral squamous part of the temporal bone. The petrotympanic fissure, also known as Glaserian fissure, is a small fissure in the temporal bone that runs between superior border of tympanic and petrous part of temporal bone. This fissure contains coda tympani, which is a branch of facial nerve, anterior ligament of malleus, and anterior tympanic artery, which is a branch of maxillary artery. The tympanic part of the temporal bone is a triangular bony plate present between the other two parts of the temporal bone, that is, petrous and squamous parts. This bony part forms the floor and anterior wall of external acoustic meatus. The inferior surface of the petrous part of temporal bone appears uneven and is vase or triangular shaped. It is bounded anteriorly by greater wing of sphenoid, medially by basi-occiput, and laterally by the styloid process of the temporal bone. The apex of the petrous part of the temporal bone is present anteromedially, and the surface near the apex gives attachment to levator vellae palatae and cartilaginous part of auditory tube. An important irregular opening known as foramen lacerum, the term lacerated, which means rough and uneven with sharp points, can be observed in this view. You must have heard term laceration commonly used in cases of deep wounds with irregular margins. Foramen lacerum is located at the apex of the petrous part of temporal bone and is bounded by petrous part of temporal bone posterolaterally, greater wing of sphenoid anterolaterally, and basilar part of occipital bone medially. In living body, the foramen lacerum is covered by a fibrocartilage at its inferior end, and the foramen opens into the middle cranial fossa at its upper end. From the anterior wall of foramen lacerum, a canal known as pterygoid canal begins and ends at pterygopalatine fossa. Similarly, carotid canal opens into its posterior wall, thus presenting the internal carotid artery to the foramen lacerum. The foramen lacerum is site of union of greater petrosal nerve, which is a branch of facial nerve, and deep petrosal nerve, which carries sympathetic plexus. The fusion of these two nerves form the nerve of pterygoid canal, also known as Vedian nerve, which reaches the pterygopalatine fossa and enters pterygopalatine ganglion. The closed part of the foramen lacerum is pierced by the meningeal branch of ascending pharyngeal artery, which itself is a branch of external carotid artery, and emissary vein. During skull base surgery, location of foramen lacerum is important because of its closeness to internal carotid artery and surrounding structures. At the posterior aspect of the petrous part, a prominent circular opening known as carotid canal is present. This canal is a bony passage inside petrous part of temporal bone and allows the transmission of internal carotid artery and sympathetic nerve plexus present around the artery. The canal tends to move vertically upwards, then turns anteromedially, and finally opens inside middle cranial fossa at posterolateral aspect of the foramen lacerum. Above the foramen lacerum, the internal carotid artery passes anteriorly to the cavernous sinus. Skull fracture involving the carotid canal may damage the internal carotid artery. Now let's move on to the posterior part of the Norma Basalis. This part of inferior view of skull is present posterior to an imaginary line passing anterior to the foramen magnum. For descriptive purposes, this area, the posterior part, is again divided into the median and the lateral parts. Let's initially talk about the median area of the posterior part of Norma Basalis. Here, the largest opening of the skull, known as foramen magnum, which in Latin means great hole, is easily visualized. The foramen magnum is an oval opening which is present in the basilar part of the occipital bone and is responsible for connecting the posterior cranial fossa to the vertebral canal. It is an important feature of bipedal mammals. Basic occiput is present on its anterior aspect and occipital condyles are present laterally. The alar ligament, which joins the dens of axis to tubercle on medial aspect of the occipital condyles, is responsible for creation of anterior smaller osteoligamentous compartment and posterior larger neurovascular compartment within the foramen magnum. Structures passing through anterior compartment are the tectorial membrane of atlantoaxial joint, upper band of cruciate ligament to atlas, alar ligament, and the tip of dens. Structure passing through the posterior neurovascular compartment are inferior aspect of the medulla oblongata, its meningeal coverings, spinal accessory nerve, vertebral arteries, anterior and posterior spinal arteries, and sometimes cerebellar tonsil. Two midline cephalometric landmarks related to foramen magnum are opistheon, that is the midpoint on the posterior margin of the foramen magnum, and Bayesian, that is the anterior midpoint of foramen magnum. The area posterior to the foramen magnum consists of the squamous part of the occipital bone. A median palpable bony prominence known as external occipital protuberance is situated behind foramen magnum. Curved bony ridges arising along this protuberance are known as superior nuchal lines. These lines form the boundary between the scalp and the neck. A midline vertical ridge known as external occipital crest extends from the external occipital protuberance to foramen magnum. A pair of curved bony ridges arising from the middle of the external occipital crest are known as inferior nuchal lines. The area between the inferior nuchal line and foramen magnum is the site of attachment of rectus capitis posterior minor medially and rectus capitis posterior major laterally. Similarly, the area between the superior and inferior nuchal lines are the site of attachment of semispinalis capitis medially and superior oblique laterally. A triangular area bounded by rectus capitis posterior major, superior oblique, and inferior oblique is known as suboccipital triangle. Vertebral artery and suboccipital nerve is present on the floor of this triangle. To perform angiography of circle of Willis, the vertebral artery is used to be accessed in this triangle. Nowadays, this angiography is done by catheter angiography with access point being femoral artery in most of the cases. Additional features of the external occipital protuberance, external occipital crest, and nuchal lines are dealt under Norma occipitalis. Now let us talk about the lateral area of the posterior part of the Norma Basalis. The prominent features of this area are the condylar part of the occipital bone, the squamous part of the occipital bone, the jugular foramen, and the stylomastoid foramen. Two reniform convex occipital condyles covered by hyaline cartilage are present lateral to the anterior half of the foramen magnum. These condyles articulate with superior articular facets of atlas and form atlanto-occipital joint. the condyloid type of synovial joint. The capsule of atlanto-occipital joint is attached on the condylar margins, and the medial aspect of the condyles bear a tubercle for attachment of alar ligament. Just superior to occipital condyle, hidden from direct view, we can observe the anterior condylar canal or hypoglossal canal, which transmits cranial nerve 12. Some researchers have till date inconclusively tried to link speech to the size of hypoglossal canal. The fracture of occipital condyle may be encountered during clinical practice. We can find an important opening known as jugular foramen situated behind the carotid canal. The jugular foramen is bounded anteriorly by the petrous part of the temporal bone and posteriorly by the jugular process of the occipital bone. Anterior part of the foramen transmits inferior petrosal sinus. Middle part transmits the three cranial nerves, that is 9, 10 and 11, and the posterior part of the foramen transmits the continuation of the sigmoid sinus, which is now called internal jugular vein. Wernicke syndrome, also known as jugular foramen syndrome, is characterized by the paralysis of cranial nerve 9, 10 and 11, which leads to the features such as loss of gag reflex, dysphagia, hoarseness of voice, and weakness in shrugging of shoulder and turning the head. At the posterior aspect of the jugular foramen on the petrous part of the temporal bone, a small depression known as jugular fossa is present. It lodges the superior bulb of the internal jugular vein and also forms the floor of middle ear cavity. This fossa is pierced by the tympanic canaliculus, which is the passageway of tympanic branch of cranial nerve 9. The stylomastoid foramen is a small round opening situated between two landmarks, that is the mastoid process and styloid process. It is the site of exit of facial nerve and the entry of stylomastoid artery. It should be kept in mind that cranial nerve 7 exits cranial cavity via internal acoustic meatus, but the nerve still travels within skull in facial canal situated within the temporal bone. The stylomastoid artery, which is a branch of posterior auricular artery, which itself is a branch of external carotid artery, supplies the facial nerve, the middle ear cavity and the semicircular canals of the internal ear. Posterior medial aspect of the mastoid process shows the presence of mastoid notch, which is the site of attachment of digastric muscle. Very near to occipito-mastoid suture, we can find a foramen known as mastoid foramen, which acts as a passageway for mastoid emissary vein and meningeal branch of occipital artery. As these vessels can be a source of bleeding during surgery, location of mastoid foramen is important. So this was the second part of inferior view of skull. Thank you for watching.